Okay, so I'm going to talk you through how to do a palpation and a trigger point release on Obturator Internus. It's an extraordinarily sensitive muscle and it's in a very sensitive area. So before you ever do this kind of treatment with your client, you're going to talk them through what the procedure entails. And I'm very explicit with my clients. I will say, so I'll get Paige to look up at me maybe, and I would say, so Paige, you know that pain that you're experiencing deep in your pelvis around your sacrum?
Yep.
I think that you might have a trigger point in your Obturator Internus, and maybe I can even point to it in my book, or I have in my clinic, I have a chart of muscles, so I can kind of point at it and say, it's right deep in the pelvis here in the bum. So what I'm going to do is I'm going to touch right here and find your sacrum, and I'm going to do a halfway point right between there, and we're going to press in and away this way. And it's quite deep, but if you have a trigger point in this area, it might be causing all of this pain that you have. So I'd really like to see if I can treat it and get rid of that pain for you. What do you say? Does that sound okay?
Yeah.
Okay. So I have her informed consent, but I'm also going to talk her through every step of the way what I'm doing. And so this is how we do it. And if you saw the video of Gail's, she goes through the origin and the insertion and the action, but we didn't show the palpation because it's not a typical one, but it is one that we do treat trigger points in, especially if you're somebody who's going to get into lots of pelvic work. If you're going to work with pregnant ladies, things like that, this is one that you will encounter. So I do this technique over the sheets because you have to tuck under the bulk of the glute max and go in on an angle. And it's just better, it's more comfortable for them. And when you get good at this, you can still palpate where it is. Do you mind standing up and coming over here? So the first thing is I'm going to find the ischial tuberosity. So easy enough, you guys have found this a million times. So now I have the ischial tuberosity here. I'm going to find the sacrum. So here's her sacrum, and I'm going to work my way down to her coccyx. So your coccyx is right here. Is that okay, Paige?
Yep.
So I've got her ischial tuberosity here, and I've got her coccyx here. Now that obturator foramen is halfway in between this. So if you kind of put your thumbs halfway in between, deep underneath that glute max in the obturator foramen, that's where this muscle is. So I find the coccyx, I find the ischial tuberosity, and then I want to tuck underneath the bulk of this glute muscle with my thumbs. So because going in this way is just so much extra work to go through. So I want to tuck actually underneath a little bit, and I want to go on an oblique angle down towards the obturator foramen. And do you feel, is it tender here?
Yep.
Where would you put that on a pain scale?
About a 4.
It's at a 4, and does it radiate anywhere?
A little bit up towards the sacrum.
Okay. So it radiates up to the sacrum, which makes a lot of sense. So I'm going to go in with my Chaitow trigger point now. So I'm going to go a little bit deeper, and look, I'm really using my body mechanics here to apply extra pressure. 1, 2, 3, 4, 5, and I'm going to come out a little bit. 1, 2, and Paige is breathing. That's really great. I'm going to recommend that she just continue taking good deep breaths. 3, 4, 5, out. 1, 2, and third and final round. 1, 2, 3, 4, 5, and out. 1, 2, and where would you put that on the pain scale now?
At a 0.
At a 0, so it's gone. So then you slowly release, and then you would do some glute massage here. You could get her to move her ankle in and out. So I'm just going to get you to medially, laterally rotate the hip. That's going to do that active range of motion that we're looking for in the obturator internus. And then if it hadn't released entirely, I could go back and treat it 2 more times. I definitely want to flush out the area. You could use hydrotherapy in this area, or it's kind of a sensitive area, so maybe just some good massage and lots of active range of motion. Send them home with some movement therapy. I would definitely be getting them to do internal and external rotation of the hip. whether it was seated or laying down in bed. You could ask them to windmill their knees, whatever way that you can think of that will be easy for the client to do so that they're compliant with the home care. So yeah, that's a very sensitive muscle. Give it a try. It won't be one of the muscles I will ask you to palpate on the final exam just because it's a really tricky one. But I really want you guys to have this as a tool because honestly, I've treated so many of them, and it's one of the least treated muscles, but once you get the hang of it and you're comfortable with it, it's really, really effective for deep pelvic pain and dysfunction in the hips. So good.